Hello, my name is Amy Sturkey. I am a pediatric physical therapist, and I am here with someone I love. This is Chris Wilson and his parents, Terry and Chip. And we're continuing a discussion about what it's like to have a son with Down syndrome. We were talking on the last video about when he was first diagnosed, which was before he was born.
Yes.
You were going to talk about OSP?
Yeah. One of the benefits, there was a lot of times people, and I had many loved ones who said, why get tested? Because if you're not going to do anything anyway, why would you want to know or kind of get bad news? Or, there are a lot of reasons. And in some ways, it's really good for us to get, at least me personally, to know and be able to be prepared. And so because we did get an early diagnosis, there were a lot of things we could do. And it also gave me a lot of reflection because certainly with the politics of our country around choice, I had an interesting response. There was a sense of I didn't feel at all inclined to want to terminate the pregnancy. I didn't quite know Christopher yet. I knew he was in there somewhere, but I didn't want to terminate the pregnancy, but I was grateful that there was a choice if I needed to do that or if I felt like I couldn't. And certainly there were people I've talked to in my life later who they couldn't have done this. And I'm glad. I just think it was helpful for me to welcome him into this world, knowing that there was a choice. One of the other things that was really nice was that we were able to plan ahead and looked around for a pediatrician that would be really good for Christopher.
Right.
And he we found out from the hospital that there was a pediatrician, pretty new, pretty young in the field, but she had done a fellowship and wanted to do kind of special study in Down syndrome and developmental disabilities. And when we went to see her and told her and met her, said we want to have our child see you. And we told her about the Down syndrome diagnosis, and I can't remember exactly her.
I remember. She said, "This is kind of exciting."
Yes, it was almost a sense of congratulations. Like there was no. Sometimes I think we were afraid we were going to get people offering sympathy, but that was not her at all. It was like, I'm delighted.
I love that.
I'm excited for you. So that was really cool.
Well, what about your family? How did they take the news?
My family, I think my side of the family, I called pretty early, and I think it was hard for them. I have several siblings. They were very supportive. I think my parents were a little kind of like, why would you want to know ahead of time? And they kind of wanted to believe maybe they were wrong. I think there was a sense of maybe, these tests, you can't really know anything for sure. So I think they were in some denial. And my parents especially had a hard time because, again, I certainly probably had a lot of my sense of the dream of the perfect child from a family that had kind of only very bright, academically and financially successful children. And so that was something that the nice thing about what happened in my, family friend was all very supportive, was that when he was born and my mother and father came to see him, they instantly fell in love with him.
Oh.
They took a look at him. And the one other thing, my sister's a nurse and she works in pediatrics. And she told me early on, I thought this is so cool. She said, actually, babies with Down syndrome are cuter than other babies. And it's true. I just got to say, it's true. Babies with Down syndrome are especially cute. So.
I had developmentally disabled people in my family. My dad's only sister and cousin that Terry and I still looked after a lot. And wasn't severely, but enough that would be considered. And so I was used to imperfection, probably more so than Terry's family. Terry had a very blessed family in a lot of ways, but I had some exposure, not to Down syndrome, but to other disabilities.
Yeah.
Terry's mom was praying for a miracle the whole time. And after Christopher was born, I wanted to call her up and say, "Here's your miracle, Grandma."
So you said you dealt with some sadness. How long did that last, and what was that like for you? I mean, was there some of that postpartum depression as well, or?
Oh well, no. I mean, it was prepartum. It was I think from the time the diagnosis came until really almost until birth. I cried every day.
Wow.
And afterwards, I don't know. There was.
Well, he was so cute.
he was so cute. He was so cute, and he was so sweet.
Because before you have this image, so you don't have an image to go with Chris.
Right.
Right. But then once he was born, and we actually have some really sweet pictures of him. It was a C-section because he was a preemie. He experienced some intrauterine growth retardation, which meant that he wasn't growing adequately, which is not too unusual with Down syndrome. They took him early. He was born at 33 weeks, about 3 pounds, 3 ounces.
Wow.
And he was in the ICU for a couple of days, and then in progressive care in the hospital for another 30 days. That was a little bit of a challenge because I really wanted to nurse him, wanted to breastfeed him, and that's a little hard to do, at least at that point in history. I did have one of the great things, and talk about kind of joy, is he was able to latch on. He was 4 months old, and I wasn't quite sure if it was ever going to happen. But I had a friend who was I forget what the name of the group is, but kind of La Leche League, I think was what it was. And so she helped, and
a lactation consultant kind of person.
And so he latched on at 4 months, and nursed for a year, and a year following that. And then he stopped nursing.
Proud. He
was so proud. He was so good too. So we'd fly. We would go visit, and he'd nurse on the plane, go to sleep. He was like the perfect traveler. And so it was. Breastfeeding. One of the things I found out later is that it's really good for your kind of serotonin levels. And so I was just kind of joyful for that whole year, and that was a gift. I think our challenges from there. A lot of the early milestones were, certainly neither of us had been parents before. So we're kind of like, well, what do you do? Like he was just a sweet baby. And then he would sleep a lot, which is what babies do. And then, my mother did come to see, and she said, well, you've got to get him up. We have to put him in a bouncy seat, make sure he saw the lights. And oh yeah, we just were kind of clueless parents. And then he was there. One of the things they had, the Down Syndrome Association had, was like this reading thing, and I can't remember. It was like videotapes, audio tapes, and so he knew all his letters and his numbers and could say them. He was probably 2.
Yeah.
And he was ahead of some of our friends in terms of reading and.
Your body parts, could identify characters from cartoons.
Nose. Right, your nose. Yeah, you're just a mess. Yeah.
So how old was he when he walked?
He did not walk. Well, that was the interruption. Then 3.5, he was diagnosed with leukemia
At 3.5 years of age.
Yes.
Yeah.
So he was getting close. He was a slow walker. Part of his he wears orthotics, and his. He scooted, and so he was getting along. But I think right with the leukemia, that kind of put him back considerably. The chemotherapy, a lot of the treatment made a difference.
You really didn't have a choice, because if you didn't do the treatment, he wasn't.
Yeah, wasn't going to live. That wasn't
going to live.
Yes, right. And that was we've never quite known what all the impact of that was, because we know kids with Down syndrome have a higher likelihood for autism. And so he did really after, before leukemia, we'd be at the store. He'd be like, hi. Everybody he'd see at the grocery store, he'd be like, hi. And then he'd be flirting with everybody. And so anyway, it was the kind of thing that was really a wonderful experience before. And we had great treatment through leukemia. So we were lucky that way.
Okay. So you had one start where you had a kid with Down syndrome, and then you had leukemia. And how quickly did you realize that things were not going to be the same afterwards?
I think we were just...
We didn't know, because he started to lose his milestones gradually, although the doctor did tell us that the treatment would set him back. It was perhaps at age 3 was the worst time to start chemotherapy, because it's such a big hump there. So, but nevertheless, it was what it was, and the treatment was effective. And he took it like a trooper. He was really like a rubber ball to go through the kind of pain and nausea that
I can
chemo
imagine.
causes. Occasionally, I would notice that he would be in a corner of a den. He would scoot around there, and when he would start to get a look on his face like he wasn't feeling well, or maybe he was feeling a little pain, and he would say, "Bye, bye, bye, bye," and I knew that's when he was trying to wave goodbye to either the nausea or the pain.
Yeah.
So that's when I would go grab him up and put him on my lap. But that's how he dealt with it. But it didn't seem to last long. He took it very well, and he was like, Terry's boss called him a little rubber ball, and that's true.
Well, and the other thing that was kind of sweet too is that the nurses were just, and the doctor were just great in terms of hospitalization. As he'd come in, we'd have him in this big stroller. We called our SUV stroller.
Your
And,
SUV
yes,
stroller.
and he'd come rolling in, and all the nurses were like, "Christopher's here, Christopher's here." And so, and they would fight to take care of him.
Yeah.
Like he was,
Yeah.
he was the senior nurse who got most pull, used to get to say who they wanted, and Christopher got the senior kind of top notch.
Chris,
We never had to
were
worry
you
about.
charming them that early
He
on?
was charming
at
them.
3,
Yes. Oh yes.
and
then
not feeling well and charming them.
but he would still he was still saying hi when he'd first come in because he like
Yeah.
hi,
Yeah.
hi. They're like, "Oh, Christopher," they have his
Yeah,
room.
we're talking about you.
Yes,
You know it.
Yeah.
And he did have a terminal diagnosis, so it's always helpful for nurses to know a child that you knew would not live, because so many did not, and children died, when we were up there. So it gave us a perspective on life.
Yeah, and he did. I mean, we did know early on. I mean, some people would say, that was a lot to cope with. And I have to say, the leukemia in some ways was easier to cope with than the Down syndrome because there was a clear track. And
It's curable.
Yeah, it's curable. The work of St. Jude's Hospital and a lot of other research really collaborated so that there was good treatment plans. Childhood leukemia is a eminently treatable disease. And so we knew we'd go in the hospital every 3 weeks, 3 nights. They'd give him chemo, and then they'd give him a rescue drug, which I asked one time, "What's a rescue drug?" And I was like, "Oh, that's why. We're basically giving him drugs that will kill him, and we need to give him drugs to bring him back."
And
Yes.
I don't know how to say this without it sounding terrible, but was it different in that you felt with a diagnosis of Down syndrome, did you feel some way responsible, whereas the leukemia you didn't feel? Or did you not feel, because some parents tell me they feel guilty.
Yeah.
So I'm sorry.
Well, I knew that Down syndrome was kind of a mutation that occurs when the egg first splits.
Yeah.
And the only thing I felt guilty about was maybe having children at a relatively advanced age or getting pregnant.
But that can happen anytime.
Yeah, that can happen anytime. It's true, but that was the one thing I knew there was a higher risk. But no, I didn't really feel guilty about it because it was kind of I don't want to call it an accident of nature, but it was an event of nature that just happens. In human beings, we have a very fragile system that brings humanity about, and sometimes the fragility of that does occasionally chip or crack or fracture.
Yeah. And I think I had a sense of, life happens. I don't think either one of us really ever were the type to kind of say why. It's like, why not? I mean,
I think
like
a lot
life
of parents
happens.
do struggle with the whys of it.
Yeah, I realize that. And I do think our own kind of belief system and our awareness of there is a great deal of suffering in our world. We, in other parts of the world, there are not nearly the kind of supports that we have here. If anything, we felt especially blessed that we had the kind of resources. When he was, the church that we belonged to very much welcomed him.
Yes.
He was baptized, and the kind of custom of the church is that you'd walk around the church with your baby and kind of hold them up. And everybody was, people were crying. It was just, it was such a sense of embrace and kind of like that this child is welcome, and loved. And so I think not everybody has that.
Yeah.
So
Most people don't, probably not at the level that we did.
and we were fortunate work-wise. Both of us had employers that were very supportive of us, that also really embraced our child, that appreciated them. So I think we're, if anything, we felt like we're more fortunate than many people, just because we had the resources, and a lot of parents don't, So,
I think this is a great place to stop this video. Why don't we continue on the next one?
all right.
Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.